Hello and welcome. Today we're going to tackle a really important topic, one that affects a lot of parents and is, honestly, surrounded by some pretty bad information: squint in children. Getting this right is absolutely critical, so let's just dive right in.
You've probably heard this, right? Maybe from a well-meaning family member, or you've seen it pop up in a forum online. It's one of those common bits of advice that gets passed around when parents first notice their child might have a turned eye.
And I'm here to tell you, based on all the medical facts, that this advice isn't just a little bit wrong, it's actually dangerous. And believing in this myth, well, it can have some really devastating consequences.
So that's the big question we're going to answer today. Why is waiting it out not an option? And how could something that seems kind of harmless actually lead to permanent vision loss?
Okay, let's break this dangerous myth wide open. We're going to look at what a squint really is, how you can spot the serious signs, and most importantly, why acting fast can make all the difference in the world.
So first things first, we need to be totally clear on what we're even talking about. From a medical point of view, what exactly is a squint? The official medical term is strabismus. And what it means is that the 6 little muscles that control each of your eyes just aren't working together as a team. They're out of sync. The result is that the 2 eyes aren't looking at the same thing. One eye might be looking straight ahead, while the other one turns in, or out, or maybe even up or down.
Now, it's really important to note that not all squints are created equal. Some, like a latent squint, might only pop up when a child is really tired or stressed. But the ones that are a huge red flag are the constant or true squint, that's when it's always there, and the alternating squint, where the turn actually switches from one eye to the other. If you see either of those, it means you need to get a referral to a specialist, like right away.
So, how can you, as a parent or a caregiver, tell what you're looking at, especially when you've got this thing called a pseudo-squint that can totally look like the real deal? Okay, let's walk through a practical guide.
This is probably one of the most crucial things to understand: the difference between a real medical issue and, well, an optical illusion. A pseudo-squint isn't about muscle imbalance at all. It's just a trick of the eye caused by the shape of a child's eyelids, especially in little babies who have a wide nasal bridge. But the real key, the way you can tell them apart, comes down to a super simple test. And here it is. This is a simple test you can do at home. Just gently shine a little flashlight towards your child's eyes and look for the reflection, that tiny white dot of light in their pupils. Now, if that dot is in the exact same spot in both eyes, it's very likely a pseudo-squint, and you can breathe easy. But if that dot is centered in one eye and off to the side in the other, that asymmetry, that's your signal to get it checked out by a doctor.
Okay, this brings us to the most urgent part of this whole conversation: the critical window for treatment. This is the reason, the number one reason, why watchful waiting is just so dangerous.
7. This number, it's everything. You see, a child's vision is basically a work in progress from the moment they're born until they're about 7 or 8 years old. What happens or doesn't happen during that time can determine how well they see for the rest of their entire life.
And this is what's at stake. It's a condition called amblyopia, which you probably know as lazy eye. When one eye is turned, the brain gets 2 completely different pictures, and it hates that confusion. So, to make things simple, it starts to ignore the signal from the weaker turned eye. Over time, the brain basically just switches that eye off, and the vision is lost simply because it's not being used.
And this timeline is pretty unforgiving. A squint might show up in the first few months, but the ideal window for correcting it's really between 1 and 2 years old. Because by age 7, the brain's visual pathways are pretty much set in stone. And if a true squint hasn't been treated by then, that vision loss from lazy eye can become irreversible. That eye could become permanently blind.
Now, after all that serious talk, here's the really good news. If it's caught early, the chances of a complete cure are excellent. There is a clear, well-established path to saving a child's vision.
Treatment is usually very straightforward and it's highly effective. It often starts with something as simple as patching the good eye. This forces the brain to pay attention to the lazy eye again and start using it. Sometimes glasses help. And for more significant squints, a surgeon can perform a simple procedure to tighten up those eye muscles and get them aligned again. The goal is never just cosmetic. It's always about getting back full functional vision in both eyes.
So, if you take just one thing away today, please let it be this golden rule. A persistent squint is not something a child just grows out of. It needs to be checked out, and it needs early correction. So don't wait, don't listen to the myths, trust the signs, do the light test, and talk to a doctor. It's such a simple action, but it could save your child's sight for a lifetime.